Selective internal radiation therapy, or SIRT, which is also known as radioembolization, aims to selectively target a high radiation dose to all tumors within the liver, regardless of their cell of origin or location, while limiting the radiation dose to normal liver tissues within tolerable levels. This is achieved by the preferential deposition of surspheres microspheres within the tumor capillary bed so that a tumoricidal dose of radiation is absorbed over a limited range for a limited time. To be considered for treatment, patients must demonstrate unequivocal and measurable CT or MRI evidence of liver tumors that cannot be surgically resected or ablated with curative intent. Surspheres microspheres may be employed in combination with various chemotherapeutic regimens, or as a monotherapy when other options do not exist. The optimal candidates for treatment are patients with unresectable liver-only or liver-dominant tumors. Patients must have good performance status, defined as an ECOG performance status of less than 2 and a life expectancy of at least 3 months. Generally, patients are not excluded from treatment based on their age or the prior therapies they may have received. For each patient, the appropriateness of treatment with surspheres microspheres is also governed by a number of well-established exclusion criteria. Absolute exclusion criteria include inadequate liver function, which is usually defined as the presence of ascites, reduced synthetic liver function defined as serum albumin less than 3.0 grams per deciliter, and reduced excretory liver function defined as total bilirubin greater than or equal to 2.0 milligrams per deciliter. Other absolute exclusion criteria include the potential for excess radiation exposure to the lungs, as determined by the pretreatment nuclear medicine lung shunt study, and potential non-targeted delivery of surspheres microspheres to the gastrointestinal tract that cannot be corrected by interventional radiology techniques. Relative exclusion criteria are typically reviewed on a case-by-case basis. These include previous radiation therapy to the liver, excessive tumor burden with limited hepatic reserve, and compromised main portal vein. A complete description of the patient selection criteria is provided in the Surspheres Microspheres package insert and training manual.